Good afternoon, everyone, and welcome. I'm Gabrielle Darville-Sanders, Strategic Director for the National HPV Vaccination Roundtable, and I will serve as the moderator for today's session titled HPV Communications, Evaluating Your Impact. Today's session is a part of the Catalyzing Your Communication to Increase HPV Vaccination series designed to provide attendees with forecasting trends within various communication channels, discuss best practices to tailoring your communication messages, empower partners to explore innovative approaches to communication, and evaluate your communication plan and campaigns. The purpose of today's session is to provide information from HPV evaluation experts on how to frame your evaluation strategy, monitor the process and impact of efforts to improve HPV vaccination coverage, and use the results in future planning. Now, before we begin, we do want to address a few housekeeping rules. Today's seminar will be recorded. A link to view the recording and a PDF of today's slide will be shared with those who have registered. In addition, the recording link will be posted publicly in the future on our YouTube channel. If you have any issues during today's seminar or have any questions for our presenters, please use the chat function. To ensure that there are no disruptions during the presentation, all participants have been muted by the host. So before we get started, we do have a quick question for you. Thinking about your roles and your organization, what challenges have you had around evaluation? Feel free to add your comments to the chat. So as our panelists, our attendees go ahead and add the information to the chat, I'll go ahead and introduce our first presenter. So for today's session, we have three speakers. The first speaker is Dr. Noel Brewer with the UNC Gillings School of Public Health. He will present on the topic of choosing measures for HPV vaccine program evaluation. Dr. Noel Brewer is the Gillings Distinguished Professor of Public Health at the University of North Carolina in the Department of Health Behavior at the Gillings School of Global Public Health. Dr. Brewer was the inaugural chair of the National HPV Vaccination Roundtable. Brewer's research explores why people engage in vaccination and other health behaviors that prevent cancer. Apart from his academic position, he serves on the Lancet Commission on Vaccine Refusal, Acceptance, and Demand, and has advised the World Health Organization and CDC on vaccination. He has also advised the President's Cancer Panel under two presidents on the National Vaccine Advisory Committee. The announcement approach training developed by Dr. Brewer and colleagues teaches healthcare providers to communicate more effectively about HPV vaccination and other vaccines for adolescents. Let's go ahead and welcome Dr. Brewer.
Hi, folks. I'll be the first of three speakers, and I'm going to focus on the question of how you choose appropriate measures for HPV vaccine program evaluation. I'm not going to be talking about some related issues like how you choose a good evaluation design, like a randomized controlled trial or something observational. I also won't be talking about how you choose evaluation mode, whether it's online or in person or some other way. There are lots of good resources for that. In fact, there's whole degrees in that technology. So let's go to the next slide. Here are my disclosures. I have federal government, I have government resources that have funded me and then funding, and then there's also industry as well as nonprofits. Next. So I'm going to talk about two kinds of evaluation. I'll start with outcome evaluation now, and then I'll go on to process evaluation. So outcome evaluation can be thought of as the systematic assessment of intervention impact. So you'll do something, and we're focused today on HPV vaccine communication interventions, but you're going to do that intervention, that thing, and you're going to see how much it changes people. That's different than looking at what you did when you were conducting the intervention, and I'll talk about that later. So for right now, we're going to focus on the intervention's impact. Now, the most obvious one is, did the program cause a change in HPV vaccine uptake? And that's the thing that I tend to focus on and really prioritize, but that's not always practical. There may be other things that we focus on. Did the changes occur in antecedents to HPV vaccination uptake, such as perceived risk, confidence, or hesitancy? So this approach is sometimes called summative evaluation, effectiveness evaluation, and impact evaluation. Next. So why would you do an outcome evaluation? Well, the main was to show a benefit to public health directly through HPV vaccine uptake or maybe a change in a health outcome. But you could also show the promise of impact, for example, by using proxies for vaccine uptake, such as hesitancy, or antecedents of uptake, such as confidence or norms. Another reason to do this is to motivate program adoption, so that you conduct an HPV vaccine communication program, and others may want to look to see, did it really work? And your data can inform that. And finally, it is important to be accountable to our funders, and this is an important way to do that. Next. So in an early stage of this, you should pick a model, a conceptual model of some sort that's existing preferably, or maybe you'll take a few pieces from different ones, and then you'll look for what outcomes are in that model. I'm going to focus here on the increasing vaccination model and just a corner of that model called the thinking and feeling module. Next. So the first part of it is that there's a disease risk appraisal. For example, I'm concerned about HPV cancers. Next. Vaccine confidence, your belief about the vaccine, not about the disease. And in this case, HPV vaccination is effective. Next. Then there's motivation or vaccine hesitancy. I plan to get the HPV vaccine for my son. Next. And all of that should lead to HPV vaccine uptake or possibly delay or refusal. So these are the boxes we might want to focus on. And as I said before, the one on the far right is the one that demonstrates the thing we're trying to change is the vaccine uptake. But the things on the left can be proxies or antecedents to that behavior. Next. So let me give you an example of using HPV vaccination as the outcome. So we developed an in-clinic communication training for healthcare providers. It takes about an hour. It's delivered by a physician. We give one continuing medical education credit. And what we did is we have 3 arms to our study, and we randomized 30 clinics to one of those 3 arms. The orange bar here shows a 5% increase when we gave them the announcement approach training, 5.4% increase. So that's statistically significant. But when we gave them a conversation training, that led to a minor increase in HPV vaccine uptake among adolescents, but it really wasn't that much. This 5.4% is statistically significant, but the gray bar is not. And that a couple percent is basically having no effect at all. And that was a training providers, instead of training them on a systematic approach where they would begin by assuming the child is going to be vaccinated, communicating in that way, and then slowing down if parental concerns came up and using a structured way to address those concerns. Instead, they would start by identifying concerns and then go through all of the concerns exhaustively. And that sort of pass the talking stick approach was ineffective relative to with this comparison group, the change in the comparison group over time. Okay, so next. So what we find is the same impact for females and males that work for both groups, and then conversation training was equally ineffective for both of those groups. Next, the training increased vaccination, HPV vaccine uptake. It reduced the time to vaccinate. Next. And it is also an NCI designated best practice now. CDC and the AAP recommend using announcements as part of routine clinical practice. So this is the main thing to walk away with here, is that this is the sort of fancy thing that one could do when you have a few $100,000 or a few $1 million. And that's probably not realistic for most of us, unless you have years and a whole apparatus around you. Next. So there are other things you can do. So one of the things we did is we interviewed folks who were in the training. We gave them a survey beforehand and afterward. And we asked them about their attitudes towards recommending HPV vaccination, their norm, what they thought the clinic norms were, their sense of self-efficacy, their abilities, that they feel like I can recommend this. I can be effective in recommending HPV vaccination. And then their intentions to do so. All of these things increased in a way that was statistically significant. And this is something that was really helpful to see. It's a weaker quality of evidence, and there's no vaccination in here, but it is an intention to recommend the vaccine, which is the main behavior we were trying to change. So this is another example of an outcome evaluation that tells a pretty coherent story, but was far, far more cost savings than the other approach. Next slide. Next slide. So now we're going to turn to the second kind of evaluation, something called process evaluation. Now, this is the systematic documentation of intervention activities. So if you sort of think of a cause and an effect. The outcome evaluation is about what happens as a result of your intervention, but the process evaluation is about the process of you doing the intervention. So it's kind of on the beginning side or the left-hand side of things. So did you implement the program as planned? And you think about things like fidelity to the curriculum or doses delivered. And then you also could think about, was the program received as intended by participants, or at least intended participants? And you might think about the number of people who attended, the number of sessions people attended, and so on. There are other names for this approach called effort evaluation and implementation evaluation. Next slide. So why would you do a process evaluation? There's a few reasons. One is to create the permanent record of everything that you knew when you were doing your intervention. This is stuff that your team will know, but once the team is no longer funded or people move on to new positions or you retire or whatever happens, that information is lost. But by creating a process evaluation that's formally written down and published in some way or made publicly available, you create an important record. Second, you can identify and fix problems. There may be things that you don't know about that your process evaluation will unearth. Certainly, even if you identify those problems and they're not fully fixable, you can let others know who might want to use your intervention approach and materials that these are problems that are existing, and you can think about in your own context with your own population what to do. Being accountable to funders is, of course, very important. And then finally, helping others replicate your program, helping others use your materials and then replicate your findings. So there's a lot of handshake stuff, things that your team knows and that you know that a stranger just picking up your paper or your registration of the study would not know about. Next. So back to pick a model and then pick some process measures. So I've chosen a model here by Linan and Steckler. It's very similar to half a dozen ones out there. There's some real similarity to the process evaluation, implementation evaluation, but they're in really different literatures. So you'll see similar words like fidelity and reach, but they have a slightly different meaning in this context than they do in the implementation science world. And for our purposes, it really doesn't matter. What does matter is you look at these and think, which are meaningful for having an impact wherever I want to have an impact. So I'm not going to go through these, but I'll give you an example. Like fidelity would be implemented the intervention as planned and done with high quality. And then if you go all the way down to the bottom, cost is the costs of delivering the intervention. Next. So let's go through each of these for the communication training. So one measure is fidelity. So participants at different clinics received identical trainings. That was our goal, and that's what we found. Next. We did this by having a person, Megan, who was our project manager, go through and evaluate every moment of every training. And they would make notes about whether the sections were covered. For example, this is the review evidence section. Did they miss any key points in the slides and the scripts? How many people were present and the time elapsed and so on. Next. So dose delivered, 100% of the dose was delivered. There were no missed key points in the slides or script. Next. And as I read through there, the part that's circled is some of the parts that of this form that allows us to identify information on dose delivered. Next. We look at the start time, the end time. The average duration was 56 minutes. That's useful for a few different reasons. One is to just understand how much people are getting. 56 minutes was the length of the thing overall. But then we're also able to, we did some timing of individual participants and people arriving a little early and late and all that kind of stuff. But the 56 minutes matters a lot for conferring CME, so we felt really good about conferring 1.0 CME. And there's a little more time on top of this for conversations people were having. Next slide. Okay, so thinking about dose received, 95% were present for the full training. 100% would recommend to colleagues, and 93% plan to use the communication strategy. So the satisfaction level here was really high, and satisfaction is often tucked in under dose received. Next, conceptually, next slide. So yeah, here we're literally using a stopwatch on someone's phone, and we have the different sections here. Next, and then we have notes for people who had to step out for clinical reasons and so on. Next. In terms of satisfaction, we gave people a survey, the post-test survey, and that allowed us to get information both in a closed-ended way. Would you recommend it? The yes, no, and then we asked them to list a key strength of the communication training as well, something they might change, and we got great information on that, and we've used that to improve our training over time. Next. Then, of course, we also had comments during the training and after the training where people made various comments. And so we went through the transcripts of the comments that people made, and we also made use of those. Next. Yes, it's very good, a great presentation. We can recommend HPV vaccination better. Next. It's easier for parents, it's easier for us. This quote actually has ended up moving into our main slides. It's something that we use to help people understand why HPV vaccination is so important to be recommended through using presumptive announcements, because it's higher satisfaction for the recommender, but also higher satisfaction for the parent. Next. So the next one was REACH. 89% of vaccine prescribing clinicians attended the training, and we would now think of those folks as being primary care professionals. The word clinician is probably a little too exclusive. We had a lot of nurses, a lot of medical assistants, which was a strength of the training. Next. So for recruitment, we successfully recruited 30 of 150 clinics. One of them ended up closing, so we were only able to evaluate 29 of those clinics. 20% is pretty low, but when you're trying to recruit primary care clinics, it's not so easy. So this 20% felt like a pretty heavy lift at the time. But being able to work, for example, with larger healthcare systems, once you have the system recruited, you often will have much higher recruitment numbers, 50, 70, 80%. Next. In terms of context, we also looked at other research conducted in the area and then other quality improvement efforts that were being conducted by the clinics during this time. There was not a lot else that was going on, is what we found. So this gives you some sense of how these measures played out in a process evaluation. You're going to hear a lot more about process evaluation in the next talk, and one that's much more focused on mass communication. But this is focused more on the kind of in-clinic primary care focused interventions. Next. So here's an example of, we also did some photos next. These photos show our intervention setting. We would just go in and set up with a screen, and sometimes we do it on the wall. Next slide. We project our slides on a wall. Sometimes there were room for about 3 chairs and everyone else stood. It was just a little of everything. If someone opened the door, we had to pause the presentation. It was a little of everything. But these photographs of the intervention space have been incredibly useful to look back on and as reminders to how things worked. And of course, sometimes we had an auditorium and it was all very fancy. Next slide. So what else could we have measured? Next. Satisfaction with the materials used in the training. We now have extensive evaluations of that. We didn't have that at the time. Next. The extent to which participants were engaged. That's something we also look at these days. Next. And finally, information about unresponsive clinics. That's very hard to get. So that's something we've never really been able to do much with. Next slide. Now, I'm going to give you, to close here, a comparison of outcome evaluation and process evaluation. So the outcome is focused on participants or the receivers of the intervention, and it can be something like, did it change knowledge or attitudes, behavior, maybe health status, and it's about hypotheses. It addresses only hypotheses in your conceptual model. It's difficult and it's super expensive. It requires a special study design, and you have to be thinking about all of that. Once you move over to process evaluation, things can get, next slide, things can get a little easier. Process evaluation is focused on the intervention activities, what the study's staff did, the intervention components participants actually received, for example. Next. It does not address any hypotheses. Next. It's relatively easy to do. In fact, there's really no reason to not do it. We should always be doing process evaluations, considered state of the art and best practice. Next. And it can be done anytime you do an intervention or run a program. Funders really like this, and it really helps you to communicate to them the progress that you've made. Next. So we'll pause here. I believe we're going to take questions at the end, and I look forward to hearing the next talk. Thank you so much.
Thank you, Dr. Brewer. We will have Q&A at the very end, as mentioned before. Please put your questions in the chat. We will now focus on our second speaker, and that is Robyn Correll with Vaccinate Your Family, or Vaccinate Your Family. She will present on the topic of evaluation and action, tracking progress, and lessons learned. Robyn Correll is the Impact and Evaluation Director with the nonprofit organization Vaccinate Your Family. She specializes in leveraging data to improve health education and communication initiatives particularly around vaccination. For the past decade, she has worked with organizations, health departments, and community health workers to bolster vaccine confidence and address vaccine misinformation in person and online. Robyn has a Bachelor of Journalism degree from the University of Missouri, Columbia, and a Master's of Public Health degree from Tulane University. Let's go ahead and welcome Robyn.
Thank you, and I'm so excited to be here. And thank you, Dr. Brewer, for that great introduction to evaluation. As mentioned, my name is Robyn. I work with Vaccinate Your Family, doing all things data for our organization. And for those who are unfamiliar with us, we're a national nonprofit dedicated to protecting people of all ages from vaccine-preventable diseases, including, of course, HPV. And communication and education projects are a big part of what we do. And so today, I wanted to share a little bit about how our organization implements and tracks our evaluation strategy for our various projects and campaigns, the practical implementation of a lot of what Dr. Brewer kind of previewed in his previous session. Next, please. So our evaluation actually begins at the planning phase before the work ever starts. I work alongside the communications and programmatic teams as they're developing their projects to think through what the goals of the projects are, how we'll go about evaluation. And as we're planning, we create an evaluation plan. And there are a lot of different evaluation plan templates out there. This is just one example, and you can adjust these templates to meet your specific needs. But what I love about evaluation plans is that they can help us think through what the practical steps are, what needs to happen to evaluate a project, particularly projects with a clear beginning and end, and particularly projects where we don't have a lot of resources to be able to chase down our impact or outcome, but we still want to make sure that we're doing what we can to measure what we did and how we did. And each of these columns on this template that I have, just as an example, essentially help us to answer, what do we want to find out? How will we find it out? Where will we go to get that data? Who will be responsible for getting it? And when will we gather the data? Next, please. But before we go through that process, a really important step is we need to first clearly define what we want to accomplish. And this could be an objective, it could be an activity, it could be both. You could have one column that's an objective and right next the activities that help meet that objective, whatever works for your project. And this is a really important column. It's the most important column in the entire template. All the other columns will depend on this because we can't measure success until we have a clear idea of what success looks like. So I want to walk you through an example of what this template might look like in practice if we were to plan a campaign to promote HPV vaccination during Cervical Cancer Awareness Month. Next, please. So once we know what we want to accomplish, then we can start to draft our evaluation questions. And this column is really to answer the question, what do we want to find out as part of our evaluation? So in our example of a health communication campaign, we might want to know how many graphics did we end up creating? That's part of that process evaluation that Dr. Brewer mentioned. Did people engage with the campaign materials? And when I create an evaluation plan, I do try to have a mix of those process evaluation questions, what we did, as well as some more as close as we can get to that outcome evaluation, which is, how did we do? Did this activity really have the effect that we hoped it would have? And you can also incorporate questions, as Dr. Brewer mentioned, process questions to help us figure out what went well, what lessons did we learn? Numbers are really great. They're an important part of evaluation, but as I think many of us on this call know, numbers can't always tell the full story. And so we can use our evaluation plan, not just to grade ourselves or to figure out if we did what we set out to do, but also to help us improve in the future. And with these questions, Dr. Brewer definitely gave it a shout out. I'll reiterate it here. I would encourage all of us to be pragmatic. It would be awesome if all of us, as we're building social media campaigns, if we could figure out whether our campaigns actually resulted in more people getting vaccinated. I mean, this would be amazing, but that takes a lot of resources. It takes a lot of bandwidth, and it's really difficult to find out because even if our campaign materials were seen by people and then they went on to get vaccinated, or they influenced their behavior or intentions to get vaccinated. There's a lot that goes into vaccine decision making, and that can be a complicated thing to kind of piece apart what the role of our campaign was. So evaluation is not all or nothing, right? There are different kinds of impact. There are different things that we can measure, and we can get closer to impact even if we can't get to that ultimate goal that we're trying to chase. And we'll talk about what I mean by that in a bit. Next, please. So once we have our evaluation questions, then we plot out how we'll go about answering those questions. What will the answers look like? And again, it can be helpful to capture those process metrics, like the number of graphics created for a campaign, how many times those graphics were seen. There's value in measuring and celebrating success and progress that your team puts into a project. There's value in reflecting on that and acknowledging it. And of course, you're accountable to your funders often to show them that, hey, you did do what you promised you would do. For social media campaigns in particular, something I really love to look at are engagements. So not just how, the big flashy number of impressions, how many times these materials were seen, but what I really like to look at is engagements. Did people like? Did they comment? Did they share? Did they save it? Did they retweet it? These can all be a really helpful clue to how well the materials were received by the audience. And another kind of aspect of that could even be percent engagement. So this is often calculated by taking the number of engagements over the number of impressions. And this gives us kind of a proportion, right, of how engaging were the materials. And this can be really helpful when you want to compare graphics within a campaign to see whether some materials performed better than others. And if our materials had a call to action in them, for example, encouraging people to go to a campaign webpage for more information, we can then also look at how many users entered our website through that specific page. And we can track the number of, the number of pages they visited during that visit, or the amount of time that they spent on our website. Those are all really great ways to help answer the evaluation question, to what extent did people engage? And there are many different approaches you can take. Dr. Brewer mentioned there are so many different ways that you can look at evaluation, and your evaluation questions and your metrics will reflect kind of what you want to do and what you want out of evaluation. And I'll share some more examples of metrics here in a bit, but this can give you a snapshot. Next, please. And then once we know what data we're going to collect, obviously, then we can start to plan on where we will find that data. And I know that Dawn will be talking a little bit about this next, but there are lots of great tools out there, especially for online communications. There's lots of free tools like Google Analytics, Meta, which has Facebook and Instagram Analytics is a great tool. Twitter has its own analytics. So those are some great tools out there. If you do have some resources to do paid services, there are also some great paid services that can help you, like Sprout Social or hashtag tracking services. Depending on the project, you can perhaps even incorporate those budget items into your fund proposal, for example. And that's why it's so great to do your evaluation plan ahead of time, because then if you do have an opportunity as you're seeking funding for the project, you can make sure that you can also secure funding for the evaluation of that project. And thinking ahead can help you do that. And then, as Dr. Brewer mentioned, you can also create your own data collection instruments or use validated data collection instruments, pre-post surveys or quizzes. You can do questionnaires. If you have a webinar or you're using, Instagram stories, for example, you can do poll questions. And those can be a really great way to collect data. And it could be even something as simple as staff reporting. Staff reporting is a great source of data information, especially that process information. Staff reporting, partner, participant feedback, that all counts as data sources. And sometimes as we're kind of thinking all this through, we might need to kind of go back and tweak previous columns because we realize that we actually don't have the resources or access to collect the data we want to collect. And that's okay. Evaluation doesn't have to be perfect to be worth doing. And so it can be sometimes 2 steps forwards, 1 step back, but that's what this whole process is about. Next, please. And then, of course, once you have all this info, you then want to plan out who will be responsible, making sure we know who is going to go after that data. Next, please. as well as the time frame for gathering that data. And you can use this column to specify a specific date range for the data. So for example, our campaign that we have here runs the month of January. So when we go to pull the data from Instagram analytics, for example, we'll want to specify, we want to pull the data from January 1st through January 31st, 2024. And if you're comparing, you also want to specify whatever that comparison date range is. And alternatively, you could also put down in this time frame the frequency. You know, if you want to put down that you'll gather this data monthly or quarterly, that's something that you can specify here. And once you have this evaluation plan written out, you can show it to your project team and your stakeholders and community partners and kind of let them know, hey, this is what we'd like to do to evaluate it. Is there anything you'd like to find out over the course of this evaluation? Anything that you don't think would work for what you have planned? And then again, it's a little dance, tweaking it based on the feedback of your partners. This is especially important if the priority population you're working with is not the same as the population of your staff or of the project team, because that priority population can let you know, hey, this metric doesn't really isn't really something that's helpful in our community, or hey, there's a better way to capture this data that can be X, Y, or Z. And so that's a really great step that I think is often missed with evaluation planning, is making sure that the stakeholders involved in the project have an opportunity to provide input. And then once we have this plan kind of set in place and we're doing the project and it's time for evaluation, I'll often add another column here at the end to just capture those metrics and results. So, you know, the indicators and performance measures, I'll go ahead and I'll put them in the row that they pertain to. And then if there's any other things that I want to add, like if I mention a particular graphic did really well, I might hyperlink to that graphic. Or if we did a formal evaluation report, we'll want to make sure that we hyperlink to that so that everything related to evaluation can be located in one place. And this plan really is where we capture all of that. Next, please. So that's just one example of planning and tracking evaluation for a specific project, especially one with a clear beginning and end. When I first started going with evaluation, I really did feel this immense pressure. You know, Dr. Brewer mentioned the power and importance of outcome evaluation, and I felt this pressure to evaluate impact to try and get to that end result. And that's really hard to do in communication, especially mass communication. And it took a while for me to realize that, again, evaluation doesn't have to be perfect to be worth doing, and that there's actually a lot of gray area that can get you closer to impact. So, you know, it's not necessarily that's all or nothing. You can find metrics that take you along this continuum from process to the closer that you can get to impact. Because we don't always have access to shot records. If we do, awesome. You know, we can go in, we can measure before and after. We can have that great measurement plan that Dr. Brewer mentioned. But if we don't have that, we can still kind of get as close as we can. So, you know, we have our inputs. Again, it's important to celebrate that input, that effort that gone into it. You know, it's important to reflect, acknowledge it. So having things like the number of social media posts, but then you also have things like exposures. You know, how many times were those posts seen? How many people attended your event? How many people went to the website? You can go in a little bit further, closer to behaviors. How many likes did their posts get? How many views did your video get? How many course enrollments? How many people did you talk to at your event? And then even kind of taking it even one step further, how many comments, how many link clicks, how many people completed the courses, not just enrolled, but completed it. And then, you know, thinking about those calls to action, depending on what your goal was of the campaign. You know, did you want them to write legislators? You can look at that. How many submitted the form? How many shared the post that you asked them to share? How many submitted a story you asked them to submit? And so even if you can't get all the way to impact and look at the number of, you know, vaccinations administered or the increase in vaccinations, you can get closer to it. So again, evaluation doesn't have to be perfect to be worthwhile. There's a lot of really great data you can collect along this continuum to get you closer and closer to that outcome and impact evaluation. Next, please. And just as a little, to wrap it all up, I know I've talked a lot about numbers today, but I really want to encourage you all to also think about the non-number data that we can collect. Next, please. That can mean things like gathering feedback from staff or partners. We always like to do a post-activity debrief where we talk about, did it go as we planned it to go? What went well? What didn't, and what lessons did we learn? And we capture that, we put it in our evaluation results so that we can remember it for next time, and so that we can reflect with our partners so that we can continue to strengthen relationships and strengthen projects. Next, please. You can also look at how campaign or toolkit materials were used. So we at Vaccinate Your Family often put together social media toolkits, and we make it very purposely open. You can take off our logo, you can put your logo on, you can change, tweak language, change colors. And so seeing how, just kind of capturing a sample of how partners used our toolkits, that can be really valuable to look at and to reflect on. Next, please. Again, social media comments, how people responded to what did they take the time out of their day to tell us. That can be really important, even if it's not part of a formal survey. Looking at what questions did they ask in the comments? What did they, did they share this because something really resonated with them? That's all stuff that you can pull off and reflect on and kind of look at as a team. And then lastly, next slide, please. And then again, Dr. Brewer mentioned this, post-event evaluations. There's some really great way that you can do a 1-2 punch with quantitative and qualitative data. So you can ask, do you plan to use the information you learned today? Yes or no? That's a really great thing. You can say 89% of people said that they'd use the information. But then a great qualitative follow-up could be, okay, if so, how? And that's where you can get those really great pull quotes. Dr. Brewer had so many of them. And so just keeping in mind that these are some great things too. This is not an exhaustive list, but I hope that you help to use both quantitative and qualitative data to help tell the story, because evaluation really helps you build the story of what you did and the impact you had. And there are so many different ways that you can do that depending on your team, your goals, and your resources. So thank you very much.
Thank you, Robyn. Please keep adding your questions to our chat. Our third and final speaker for today is Dawn Crawford with BCDC Ideas. If you joined us on the first forum, she's coming to kind of wrap us up for this last forum, and she will be presenting on the topic of sustainable tools for communication, evaluation, and reporting. So Dawn is the engine behind BCDC Ideas, and she's dedicated her career to do good. She brings her considerable experience and expertise to helping elevate the nonprofit sector. As her team's lead strategist, Dawn is often seen leading idea storms, penning communication plans, or training clients. Before launching BCDC Ideas in 2010, she earned her chops in 10+ years of communications leadership roles for public health, healthcare, and youth-focused nonprofits. Working for nonprofits is Dawn's dream job, and she loves that our 40+ hours a week make the world a better place. Let's go ahead and welcome Dawn.
Hi, welcome everybody. So thank you so much to the two previous presenters. I think, so my job today is to kind of make this tangible for the everyday person, right? Like we had really great, giant, really powerful evaluation from Noel. We had Robyn, who's really looking at it at a campaign level, right? Of like, how do you make sure that your campaign is great? So now you have these really cool messages from Noel, from Robyn, from a bunch of organizations, right, around the country. You have the messages that work. So how do you make sure that they continue to work, right? Like we all kind of know that we all get kind of tired of hearing messages over time. So mine is really about that sustainable tools for communication, evaluation, and reporting. You know, after we've had the really intense, exciting period of developing these messages, how do we make sure that they're continuing to be used and are useful for our communities on communications? Next slide. So I'm Dawn from BCDC Ideas. We're a communications agency that works exclusively with nonprofits. Feel super excited and honored to be able to do this every single day. Find us everywhere at BCDC Ideas. Next slide. So yes, you have sizzling hot content, right? You have gone through Noel's evaluation process. You've done focus groups. You know that these things work, right? You have Robyn's campaign. You've put it out in the world. You've put it through the rigmarole of actually living in the real world with real social media comments. So, but how do you sustain reporting, right? that this isn't really all about just those flashes in the pan. We know that communications around vaccines in particular, that folks debut into caring about these messages and all of a sudden caring about HPV vaccination. So how do you kind of sustain this over the long haul? Next slide. So my biggest thing about sustainable data and tracking is about really using data to prove your point. So if you're working towards a grant, right, that maybe you got a grant to do all this process of launching the campaign, but you've also asked for money to sustain this funding for communication with these areas, with your audiences. So you really want to figure out like how to use data to prove your point. At this point, when we're in the sustaining stage, we want to make sure that it is working and that it is really doing what you want it to do. So track the things that prove that it's working, right? Like if it is engagement, track that utmost. Make sure that you are getting the likes and the comments or the conversations that you want. Maybe it is just traffic, right? Maybe it is just eyeballs to the website. Maybe that'll impress the people who are funding you. Don't overwhelm your people, your reporters, or yourself with a bunch of numbers when we're thinking about sustaining long-term. Really focus in on what are those key indicators that prove that the campaign is continuing to be successful or declining, right? What are the numbers that you're looking at that is going to help you prove your point? And then also share the numbers that mean the communications and how it's influencing your decisions. So if you also want to make a case for doing more video, look at data points that really help you prove that. Next slide. So how do you make this fit? I think this is something that is really hard for folks who are practitioners and on, kind of the folks who are doing this work day in and day out, is how do you make all this evaluation fit? Truly sustainable evaluation, is just really takes an hour a month. So just remind yourself, in general, you have around 180 hours of work if you're a full-time employee. So make it fit. It is really, really important to continue to track numbers around your social media, around your email, around your website that helps you prove the efficacy of your programs. Next slide. So there's some different ways that we can share our data, right? So not everything has to be like a giant, beautiful document, and not everything has to be a spreadsheet. So I'm going to talk about two main methods. Next slide. So these are the two best options for folks who just want to do sustainable reporting, evaluation of your communications for the long haul. So we have just the facts is the way that we're actually preferring to do for our clients right now. So this is just a spreadsheet with top line details, plus your interpretation and evaluation. So your own, summary and interpretation of that data as a nonprofit as a vaccine communications professional, that you want to definitely add that to that, but it's just a spreadsheet, super easy. I'll show you. And then there's also the full story. So this is more of a documented journey of your data, right? So if you have board members, if you have funders that you need to really prove the value of their donation or of their grant or of their involvement in the project, then that's probably the way to go, right? It's much more of a grant evaluation, and I'll show you that too. Next slide. Just the facts. So I really love this way of doing monthly reporting. It goes pretty quickly, and you can really see easily comparisons of these points over time. So as I kind of talked about in my very first presentation in this series, that social media engagement is declining across all channels and across all clients and across all areas. So this is such a great way of actually seeing that decline. We can just see that engagement and reach are reducing over time, which is super fascinating. And I think this is really the easiest way of seeing that. So literally for just the facts, you're just going to set up a spreadsheet, either in Excel or a Google Doc. We love Google Docs because then everybody can see it and kind of see what's happening. And then you can track the things that are most important to you, right? So is it engaged users? Is it impressions? Is it post reach? And then you can also even track on specific, messages, right? Because we're just using the same set of messages over and over and over again in vaccine communications because we know they work. So you can track that just in a spreadsheet, just do it. And then just once a month, same time every month, just go in and add your totals. It's a really nice way of keeping yourself accountable, but also really seeing those trends and seeing when things are kind of doing well or honestly tanking. Next slide, please. So the full story is definitely a Word document. It is much more of a narrative. It is taking your readers on a data journey and telling them exactly what they're seeing and then backing it up with graphs and charts and examples. So some of our clients certainly require this, right? If they have a board who is constantly asking, why are you spending money on communications? This is a great tool for you because it feels impressive. And it is impressive, right? It has all of your knowledge. It has all the data. It's something that it's a deliverable every single month. So this one does definitely take 2 to 3 hours per month. But with a template, it's pretty easy to go back through and just quickly add all the information that you need. Next slide. So there's tools that you should definitely use. You can use all the free tools, so the in-app applications, so Facebook and Meta Business Suite, Instagram Analytics, Twitter Analytics. They're good, they're basic, they're okay. They also change the way that they record their numbers without telling you. So your numbers will look different from year to year. But it's good for snapshots. Hootsuite is still a great tool for evaluation. And it's cumbersome, but it's still a good tool. We love Buffer. I'm not paid by Buffer, but we do love Buffer, and it's pretty affordable per month. And then definitely Sprout Social is amazing. It does a lot of this kind of reporting for you if you set the reports correctly. But it's also the Cadillac, right? It's a little expensive. So really kind of figuring out what is a good option for your organization is critical. And also do your own research, right? There's tons of options out there. There's a lot of money in social media evaluation. So definitely do your own research. Next slide. Other must-haves, please have Google Analytics on your website. Please use Google Sheets to share your information. And there's some additional tools here of Looker Studio, and also just Google search to teach yourself everything else. So finally, next slide. So why should you measure beyond that initial evaluation? Next slide. Is that it guides your decisions, right? It'll help you decide what you want to do next. Do you want a new campaign? Do you want to test a new image? Do you want to test a new message? This is really what this sustainable, reporting will do. Next slide. It proves your worth, right? Communications is something that we do have to constantly kind of prove that we're a valuable member of a nonprofit team or a government team. So, it proves that you have a lot of knowledge and smarts and that you can change things through your communication. Next slide. It feels good, right? Communications is a lot of intangible things, right? It's a lot of social media posts. It's a lot of things that just go out and have a 24-hour importance in the world. So having this data says that you had that many people look at it. You had that many people engage with it. It feels good. And it's one of the only tangible parts of our world, besides making pretty things and saying pretty things and smart things, that this data proves that you know what you're doing, and that can really help you get more grants, get you more influence within your organization, and just have more weight in projects. Next slide. So finally, I think through all of this, right, that data and evaluation is a tool to make your decisions, right? It helps you figure out what to do next, track what's actionable for you. I think even in Robyn's conversation, right, that pick the things that are most important to your organization and track those. What are your North Stars? What are the things that matter? Definitely control your data narrative. It is your story to tell when it gets to this point. So share the facts that really help you shine. And then just make it fit. Please do it. Please find time for evaluation. Your organization will be stronger for it because you'll know what's happening, after you push post on Facebook. Thank you. And the next slide. Thank you so much for your time. and we're ready for Q&A.
Awesome. Thank you, Dawn. Such engaging conversations, such engaging presentations. We've had a few questions in the chat, but please keep them coming. I will now turn it over to Tina, who will facilitate our Q&A session for the remainder of this forum.
Thanks, Dr. Gabby. I'm Tina Turpin. I'm a director for the National HPV Vaccination Roundtable, and I will be moderating this Q&A session today. So let's make sure we have everyone here. And thank you, Dr. Brewer, Dawn, and Robyn for your presentations. We did get a few questions. So I'm going to start with Robyn. And I just want to shout out, Dr. Brewer put this in chat, but I love the evaluation doesn't have to be perfect to be worth doing. I feel like if you take home one thing today, it's like, just get started. That's what we're trying to do here. So one question that we had for you, Robyn, is when evaluating a multi-year program, do you focus on outcome evaluation year over year in addition to process evaluation, or do you primarily focus on process evaluation with outcome evaluation at the end of the program overall? And I'll open it up to everyone after Dawn as well, if you guys have other things to say.
Yeah, I think it really depends on the campaign. I hate to say that. I know in public health, it depends is like our favorite thing. But I think for, there are certain campaigns we do every year, like we always do a flu campaign. And so it can be really helpful for us to see, where our materials used more often this year? How did our materials get used? Did they get more engagement? Did we have a higher percent engagement on our materials? I think that's stuff that's helpful to compare year over year, especially if we have a campaign that maybe didn't perform as well as we thought it would compared to the previous year. That could be an opportunity to kind of dive more into that process. But I think it really just depends on the campaign and kind of what we're hoping to get out of the evaluation. I think outcome evaluation, when we can do it, awesome. And comparing year over year is really great. But I think Dawn touched on, it's really hard to do that, especially if social media is part of your campaign, because the way that they measure that data and the way that they report that data changes. So it's very rarely are we able to compare apples to apples, even if we're talking about the same platform, the same kind of campaign in the same year. It's just sometimes even Google Analytics right now is switching their platform. And so even how we capture website data is going to have to be different now. So I know I don't have like a clear answer for you, but I think outcome when you can, but recognizing the limitations there. Yeah. But definitely always process, like what Dr. Brewer said.
Yeah, and I think that really speaks to kind of what Dawn said also about do what's actionable for you. So when you're tracking, make sure it's something that you really want to take action on and want to see information on. And so this next question is for Dawn. How do you measure engagement?
I can make just one comment here.
For sure.
I think the interpretation of the data is also important. With outcome data, it's pretty easy to misinterpret what you've got. And so you have to take a lot of care. You need the right kind of study design. You have to be really humble about what you make of the data, even though it's like fancy data to have vaccination outcomes. It doesn't necessarily mean you can say anything much happened. It's outcome evaluation. There's like a lot of subtlety and art to it, and a lot of the answers you think you got are not really there. With process evaluation, it's a different it's kind of a different discipline almost. It's a bit more straightforward, less costly, and in some ways more valuable because you can kind of almost always use it. The only caveat I have about process data is you cannot claim that a process outcome means there was an impact. It can be subjective or indicative or promising or whatever it is. That's the only sort of caveat that I would make about process data is we can't claim that because we had 50,000 views, that meant the vaccination increased by this much. So that part is, some people will make that claim. I heard nothing like that on the call today, and I don't think that was ever intended to be claimed. But that would be the only caveat I have. But I went into this whole business thinking like the only thing that matters is outcome data, and I've kind of changed my mind that like process data is where we all start and live and breathe, and then outcome evaluation when you can.
Great. And since I have you, we'll stay with you. We have a question for Dr. Brewer. Do you feel that providers are being honest about their own hesitancy, even if they take a training? We are hearing that some providers aren't willing to talk with younger kids, 9 to 12, about HPV.
Yeah, sure. I mean, they're a bit optimistic. I mean, what we find is that maybe what we get in our evaluations is the best possible story, but it's not entirely positive, I'll be honest, that there's still a lot of room to grow. And then if you do things like record actual interactions, you'll find that the reality goes quite a bit lower than that. So like the difference is often a 20 or 30% drop. But if there's a change in where they thought they were to where they think they are now, that's still, I believe those changes are meaningful. The absolute levels you can have some critiques about those, but the changes are generally quite informative.
Okay. And then Dawn, do you consider the target audience, age, communication preferences, individual behaviors generally in your evaluation strategy? And should that be considered? And feel free, I know Robyn, you kind of touched on this as well. So we can start with Dawn.
Yeah, I think Robyn is probably better because it's more on the campaign level versus sustaining level. Because that would be, because your messages would determine, your audiences and that sort of thing.
What do you think, Robyn?
Yeah, I mean, I think it's audience is obviously really, really important with all communication and all intervention strategies. For example, if you have a campaign and your audience is actually vaccine advocates, and what you're hoping that they'll do is share the campaign materials with their followers or with their networks, then you're going to measure different things than if you were trying to reach, for example, Latina pregnant women between the ages of 25 and 45. I think, and the kinds of data you're able to collect are also going to be different depending on those campaigns. So like, if you're not able to really get to the measurable change in vaccination rates or even measurable change in views on vaccination, you might be able to get some really interesting data from the qualitative stuff, like what comments did they make in the posts, and that kind of data can be illuminating. Again, like, I don't think there's any perfect way to do evaluation. I think it really just depends on what you're really hoping to do with that data. I mean, data for the sake of data is just wasted time and effort. When you collect things, you kind of need to know, okay, well, then how will I use this? And when it comes to certain priority populations, I think that's where, especially if you're not a member of that priority population and you're planning it, reaching out to them and asking how, this is what we want to find out. What's the best way for us to do that? Do you have any suggestions for how we might be able to go about it? We work a lot with community health workers, for example. They're a really great group to go to because they have a very intimate knowledge of their communities. But I hate to say it, it depends. It depends.
One theme that's come up throughout this from all the talks is that we should be practical about what we do. And that it's better to do something straightforward, something really complex that just starts to feel overwhelming. So there was a little chat between Robyn and me on this, through the chat function about how long we would take. And like starting with, spending an hour just to sketch things out can radically improve what you're doing, because it'll force you to think about, oh, who am I trying to talk to, and what kind of impact are we meaning to have, and what's the shape of this thing? And by getting it out of your head and on paper, it will look a little ugly for a few minutes, but then you can sort of massage it and you make peace with, oh, it is actually in this shape, and then maybe there's these ways to make it better. So I really love Robyn's. It's a fairly ambitious evaluation plan template, but even if you just take a couple pieces of that and write it down. I also really liked Dawn's comments about her different ways she reports out, and that increasingly she focuses on this sort of simple, here's just the key findings, a few percentages. I find myself doing the same, especially when I'm talking to people who are not eggheads like me, who are like in the real world. I just want to give them a few percentages in a summary, and then you can hear what questions they have, and you can have a couple extra slides in the back to say, oh, well, yeah, I can address that. Like in the chat, someone asked, do you ever stratify by race and ethnicity or other priority groups? And absolutely we do. And I'm sure the others here do as well. It just depends on what the focus of that is. In our own work, we always now try to do those stratifications as a matter of principle to try to understand equity issues in the interventions we do.
Great. Thank you, Dr. Brewer. And at that, it was a good summary of what we've heard today. We are going to wrap up. Gabby's going to put a link here in the chat for our survey while we're on the topic of evaluation. So please take a minute to take that survey. You can also see the QR code on here. I want to thank Dr. Gabby Darville-Sanders, Dr. Brewer, Robyn, and Dawn for their presentations today. You will receive this. It was recorded, and the link will be available soon, along with a PDF of the handouts from today's presenters. We hope this is our final one of the Communications Forum. We hope that you learned information that was not only insightful, but applicable to your communications strategies and activities. And, we heard a lot today, like just get started, get some stuff down on paper, reach out to us. You can watch this recording, and just kind of move forward. So I hope that you guys had a great time with us today, and thank you for joining.